I am joined by Dr. Min Wen, who is here from Hoag, and he is a medical oncologist. So we're going to talk about some of the things that you need to still take into consideration during COVID-19 and know that they are treating people. Isn't that correct, doctor?
Yes, absolutely. Healthcare doesn't stop amid COVID-19, and so we still are needing to see our patients.
Excellent, excellent. And I know that there have been a lot of changes that have gone on in terms of preparing for people to come into the facility. But what are some of the things that, what have you guys been doing in addressing the COVID-19 and treating your cancer patients at this time?
Yes, so we've had to make some dramatic changes in the way we do things because of COVID-19 in the sense of keeping everybody safe, not just from patient standpoint, but also our staff and our office. And so we've done several things. Number one, we are limiting the patients we see to the more urgent patients right now. For example, we have some routine follow-up patients who are years out from their cancer diagnosis that don't necessarily need to come in right now. We can delay those follow-ups for a couple of months, few months. Mm-hmm. Obviously, the patients who are actively being treated for cancer, whether it be on chemotherapy, radiation, we're seeing those patients in the majority to make sure that their treatment stays on time and that they're appropriately taken care of. Okay. So by decreasing the amount of appointments we're seeing, it decreases the flow through the office. And so we don't have as many people in the office in the waiting rooms, for example. The other thing we've had to do is change our staff scheduling just to allow for less patients to be seen in the office. So, for example, the chemotherapy infusions, because the chairs are close together, we are actually spacing those apart now so that patients are not next to each other. And in order to do that, we have to prolong the times, the office time that we're open in order to accommodate those infusion times and space patients out. So we've gone from an 8-hour day to a 12-hour day. And in doing so, we've split up our staff so that half can work one day and half the other day.
There's a lot of preparation that not so much preparation, but there's a lot of changes. And especially with people who have had cancer, because I understand, that is one of the areas that most people were worried about in terms of contracting COVID-19.
Absolutely. Our patients who are diagnosed with cancer, they're often on immune suppressive therapies, whether it be chemotherapy or radiation, or even surgery in the post-op setting. These patients are at increased risk for infection. And so these patients are at greater risk than your average population for COVID-19. There's a lot about COVID-19 that we don't really know and understand because it's such a new disease. It's a pandemic. And so we're learning from small studies. And looking at some studies coming out of China, we've realized that cancer patients have not had an increased rate of COVID-19 infection, which is good. But at the same time, those cancer patients make up a very small number in these studies. And these studies are already small to begin with. So we're talking case numbers of 20 or 30 patients with cancer and looking at the COVID-19 rate. So I don't know that data is really reliable, saying that their rate of infection is the same as the population. But we do know that they are certainly immune suppressed. Our chemotherapies cause a decrease in their white blood cells and their neutrophils, and certainly they are at increased risk for infection. So I always counsel my patients that whatever everybody else is doing, you need to be 10 times more vigilant because you're at greater risk.
Absolutely. And thank you for addressing that, because I think when we look at some of these studies, we're looking at what's the bottom line, but we're not looking at the whole picture. And so when you hear that, only 20 patients with cancer, that's nothing compared to how many people do have cancer.
That's correct. And that's why it's a moving target too. We hear it even just for the general population on what you're supposed to do. Wear a mask, don't wear a mask. CDC is changing their guidelines based on information that's coming out. And so even though we have these small trials coming out of China, the data, I think, in my opinion, is unreliable. And so we just need to protect ourselves best we can.
Excellent. So if you have patients let's just say the patients that you do have who are in our community And, they might be afraid because a lot of people have been very afraid to go to their regular doctor, to go to the hospital, to go to any treatment. I know you mentioned that you've separated your chairs and now you've changed your staff. Is there anything else that you would want them to know so they aren't afraid?
I think that we need to continue with our screening modalities. Just because of COVID-19, cancer doesn't stop. And my major concern is that everything has shut down in the past 3 months. We're just starting to reopen now, but things have stopped occurring in the past 3 months, including screening procedures, whether it be because facilities aren't open or patients are afraid from coming in. And with the lack of screening, um, I'm concerned that in the next 3 to 6 months or a year, we're going to start seeing a large number of cases of people coming in with more advanced cancer,
Mm.
cancer that is more difficult to cure because of late findings. And so I would urge that people still stay on top of their cancer screening routine. For example, uh, you know, uh, breast cancer and getting breast mammograms done. While it might be okay to delay your mammogram a month, I don't know that it's okay to delay it several months. And so I would urge that people still go in for their screening procedures. At Hoag Hospital, things are being done very cautiously, opening back up. I think Hoag just reopened up their screening modalities in the last few weeks, whether it be a screening colonoscopy or screening mammogram. And so precautions are being taken into allowing patients into these facilities for screening. For example, colonoscopies, um, patients are allowed to have one visitor with them only. They're not allowed to bring in multiple people, so we're trying to minimize patient flow through there.
Okay.
And anytime patients are coming in for procedures, they are required to have COVID-19 testing done 3 days in advance. And once that swab is done, we ask that patients self-quarantine for the next few days until their procedure occurs, such that they don't obtain the virus in those few days right before the procedure. And so we are taking appropriate steps and precautions in trying to keep patients safe. And again, I think these screening procedures are necessary because if colon cancer isn't caught early, oftentimes it has spread to the lymph nodes. And when cancer spreads to lymph nodes or even beyond that, it becomes more challenging to cure. And our goal in these screening procedures is curability. We don't want to find patients with late stage cancer. We want to make sure that we find them early on and that they're in a area that we can still offer curative therapies, whether it be surgery and or chemoradiation. So it's important to have that screening done.
So, in regards to some of the new practices that I think you guys have been going under, and not just you, but across the country, really, is a telehealth.
Mm-hmm.
And you had mentioned that's something you guys have been doing. So, tell me how that helps in screening people for cancer.
So telehealth is something that has kind of been a need in these times. It's a technology that has been around, but nobody has really latched onto it quickly. But now we are all forced to do it very quickly. And as physicians, we are learning that technology very quickly, kind of like these Zoom meetings. We are able to connect to our patients through these telehealth, to touch base with them to see how they're doing. Telehealth allows the patients to talk to us, and in even just talking to people, we're able to screen them for symptoms, screen them for any abnormalities, and if those screening questions show of any concern, then we're still able to bring them into the office for an actual physical exam. And so telehealth has really transformed what we're doing. It allows patients to connect to us safely. And by the way, I think telehealth also is dependent upon the end user. Not everybody is comfortable with telehealth, especially in my patient population where people are a little bit older and not comfortable with technology. Even though I offer telehealth, many patients are still asking to come in face to face because they're not comfortable with just a video conference. They want to be able to see their physician and they want to be able to be examined because ultimately that is the safer approach. But in the current time that we have, telemedicine does allow us to at least connect with patients preliminarily to screen them and say, okay, yeah, you definitely need to come in for a visit to have this problem checked out.
Right. And it's good to know that you guys are opening and you're open now and you can take patients and you've done all the precautionary measures to make sure they're safe, because I think for this whole time there has been a fear, and you addressed that earlier. But again, it never hurts to say it again, that it is okay to see your doctor. It is okay to go get your screenings now, because you guys have made so many changes.
Absolutely. And in fact, the disinfecting protocols have changed. I mean, we're wiping down the exam room as soon as someone walks out. That whole exam room gets wiped down before the next patient goes in. The table, the exam table, the countertops. Our staff are wiping these things down before the next patient comes in. Obviously, people are getting screened for symptoms as they come through the front door. Their temperature is getting checked. At Hoag, there's an advanced system of infrared technology where you just walk through the door and a camera's on the face and taking your temperature as you walk by. And there's someone at every entrance screening for symptoms, cough, fever. Anybody with symptoms is being asked to not enter the hospital. And obviously anybody who's screened with a temperature is asked to not enter as well.
That
So
is
yeah,
awesome.
lots of things are being done to make sure that people are safe when they enter the facility.
Well, you're the first one I've heard about the infrared. That's pretty cool.
It is cool. Initially, they had just those regular thermometers that they shoot at your forehead to get a temperature, and you have to pause and talk. Now, the infrared, you walk right by the beam and it gets your temperature right away, and the person standing at the table asks you a few preliminary questions quickly, and you can get through within a matter of seconds rather than minutes.
I love it. That is really awesome. Well, thank you so much. This has been great information, and hopefully the viewers will heed the advice and not be afraid anymore. So thank you for all that you guys have been doing.
Absolutely, absolutely. And I want everybody out there to know that even though COVID is around, life still goes on, cancer still goes on, and screening is still important. So reach out to your physician, reach out to your primary care docs. Everybody's doing telemedicine now. It's readily available. You should be able to talk to your doctors very easily.
Okay, great. Thank you so much for the time.
Absolutely. Thank you.
All right. And we'll be right back after this.